What is Medicare and how does it work? Welcome to my Part 2 journey. Welcome to my Part 2 Medicare journey. I am Nurse Marsha. Now, I did a video about Medicare Part 1. What is Medicare and how does it work? I'm going to leave a link to that video in the description below. In that video, I gave you some basic information about Medicare, and I shared with you the things that NurseMarsha is doing in preparation for her Medicare in 2024. So in this journey, I'm going to continue to share with you the things that I'm doing to prepare for my Medicare. Now, the next thing that we need to do, you and I, we need to make some decisions. We have two basic decisions we need to make about our Medicare. Decision number 1, how do you want your Medicare? Decision number 2, if you're going to take Medicare Part B. How do I want my Medicare? Let's talk about that. You have some choices. Do you want what is called original Medicare? Do you want Medicare Advantage? Are you going to buy the prescription coverage, which is Medicare Part D? Are you going to buy Medicare Supplemental insurance, which is called Medigap? And your decision number 2, are you even going to take Medicare Part B? So let's talk about the first decision. How do you want your Medicare? You're going to have to make a choice. Do you want original Medicare, which comes with a Medicare Part A and B, Part A, which is hospital insurance, Part B, which is medical insurance? Or do I want to get a Medicare Advantage program? Now, if you decide to get a Medicare Advantage program, you are just transferring Medicare Part A and B. You're transferring that to a Medicare Advantage program, which is run by private insurance companies. Now, Medicare Advantage is a whole nother beast. Nurse Marsha will cover a special video about Medicare Advantage insurances, the pros and cons. So now would be a good time to subscribe to my channel, hit the notification bell so you will know when I upload that video. Next, you need to decide if you're going to buy Medicare Part D, which is drug prescription. Now, they say you don't have to buy that because some people may not be on medications now when they enter into the Medicare program, but we never know if you're going to go on medications. Also, if you don't buy Medicare Part D initially, there's going to be some penalties later on when you decide to buy it. Next, do I want a Medicare Supplemental program? And why would I even need that? Medicare Part A and B does not cover our healthcare needs 100%. We will pay co-pays, co-insurances on the services that we get. So this Medigap or Medicare Supplemental insurance will take care of our out-of-pocket expenses if we decide to get into original Medicare Part A and B. Decision number 2, do I want to accept Medicare Part B, which is the medical part? The reason why you have a choice to make if you want it or not is because we have to buy Medicare Part B. We have a monthly continued premium for Medicare Part B. In my video, Part 1, What is Medicare? I told you that Medicare Part A, we've already paid for while we were working. So with Medicare Part B, there is an ongoing monthly premium. That's why you can have a choice if you're going to buy it or not. Now, most people buy it because, again, there might be some penalties later on if your health situation changes and you may need Part B. Also, some other circumstances that people may fall into. They may not need Part B, such as if you are still working and have health insurance from your job, if your spouse works and has health insurance from their job, if you are a retired person who has health insurance as a retiree, if you are someone who is on the state Medicaid program, you may not need to buy Medicare Part B. Every situation is different, and the best way to find out where you fall is to call Medicare or go to the website Medicare.gov, or you can call their 1-800 number, 1-800-Medicare. I'll leave that information in the description below. You also can call your state Medicaid program if you are someone who is currently getting Medicaid. You can also call your HR department or your retiree department if you are someone who is still working and or retired with health insurance benefits. How do you even find a Medicare Part D insurance plan and a Medicare Advantage insurance plan, or a Medigap or a Medicare Supplemental insurance plan? Well, you can go to the website Medicare.gov. You can do a search on the website after you create an account. You can search for Medicare Advantage programs in your city and state. You can search for Medigap supplemental programs in your city and state. And you also can search, find, and purchase your Medicare Part D drug prescription insurance plan. You can do it all on that website. It was very easy. You can even put in the current medications that you're taking, and it'll give you the amount that you will have to pay or your out-of-pocket costs for the current medications that you're on. I encourage you to go to Medicare.gov, and or you can call the 1-800 number, 1-800-Medicare. Again, I will leave that information in the description below. So I hope this helps. I hope I brought value to you. So subscribe to my channel, hit the notification bell, leave a comment, and most importantly, share this video. Share Nurse Marsha. Don't keep me to yourself. Bye.